Mercury toxicity is tough because the symptoms, they're unusual. I call it the MMA. It's mood swings, muscle weakness, and anxiety. Now, come on. Don't we all have muscle weakness? I mean, I barely can walk my dog around the block and I have muscle weakness. Mood swings, I'm a woman in my 50s. And then anxiety, don't we all have anxiety? So that's really hard to tell if you have toxicity from mercury, because a lot of the main symptoms are in common day life. And so what you have to really be careful with, and I tell my patients, they're like, I know I have mercury toxicity. I say, well, go get your blood tested. You can have your blood tested for $30 and find out if you have high levels of mercury in your blood. And there are certain things that aid to mercury toxicity, and I can get into that in a second, but I do want to address how holistically in dentistry we avoid mercury. We avoid amalgams. Amalgams are 50% of their weight is mercury. Amalgams are fillings that are silver in color and they're mixed. And when they're mixed, 50% of that is mercury, and they're plugged in your tooth and release mercury at I think high levels. And so I would not prefer to ever use that component to fill your tooth. I used white colored fillings that I even researched the amount of plastics that are found in those white colored fillings. Like we have BPAs and we have all kinds of toxicities in plastics we have to avoid. So I go a long way into ensuring that even my white colored fillings don't have any types of toxicities. But yes, in dentistry, the highest type of filling material that is the most toxic is those that have that mercury component, because mercury is known toxicity and 50% of that is in that area. So when you're holistic, you definitely don't use silver fillings. Where other places you can find mercury are low-dwelling fish. People eat fish all the time. Fish is a great diet. It has omega-3 fatty acids. It's great for your body. It's a high level of protein without a high level of carbohydrate or calories. So you want to eat fish. It's in your diet. It should be in your diet, but you have to be careful what types of fish you select. Tuna is an example. I had a friend, Jackie, who loved tuna so much that she ate tuna every day. And come to find out, she got really tired, muscle weakness, fatigue, anxiety was up high. I said, let's test your blood. She tests her blood, and it turns out mercury was in her blood at a high level because she was eating that tuna every day. You can't eat tuna every day. It's a great form of protein. It's a wonderful diet food to use, but you should limit yourself to once a week. And there are different doctors that can tell you what is best for your body for that. I'm just saying mercury can be found in other areas. Obviously, when you were a kid and you saw that mercury thermometer, there was mercury in that. That thermometer with the red that would go up and tell you the temperature, that had mercury. My dad told me a couple of days ago that he used to play with the mercury that was in the thermometer. That absorbs through your skin, and that's mercury. And so that's damaging. You cannot touch mercury in the thermometer. There are other places that mercury can be found, but those are the main components: fish, amalgam fillings, and thermometers. So stay away from those and you'll be fine. A lot of patients want to know, if you get mercury toxicity, what do you do? And I have patients come to me because I'm holistic that have already been diagnosed with mercury toxicity, and I do remove their silver fillings. The highest levels of mercury can be found when placing a silver filling and removing a silver filling. So obviously these patients come to me and they already had these placed when they were 6 years old or 7 years old or even in their teens, and they're like, I need them removed, and they're 8 and they're 50 now. And so we have a safe technique, which is a way to remove the mercury fillings, but be safe about it. And so we isolate the tooth. We don't let you ingest. There's a whole series, a list of series. There are 12 different things we do. We almost look like we're going into an outbreak situation where there is Ebola. because we're trying to avoid that any kind of inhalants that get in the air that release mercury. It's one, to protect my employees, we look like that, but to protect the patient. Their mouth's wide open and they're going to inhale some of this mercury, and we don't want that. So we have high level vacuums. We have even after we vacuum it up, I have a called a mercury container that holds the mercury, and then I recycle it correctly. We have a rubber dam, which is a plastic piece that I put over the teeth to keep you from swallowing any of the mercury. I even do some holistic rinses with you beforehand. I do a rinse of cholera and charcoal. Both of those components are supposed to be chelating agents, which are agents that surround the mercury and bind it, so that if you did swallow it, it would come out in your digestive system instead of go into your blood. So we do all sorts of things to try to keep you safe from mercury.